Hello and welcome to this special show on Rajya Sabha Television. I am Vishal Dahiya, and herein we bring you all the details about what is being done in India's fight against COVID-19, be it the development of drugs, vaccines, or several other aspects, specifically what our COVID warriors are doing on the ground so far in the past 6 to 7 weeks. Now, there is one important aspect in this fight, and that is health infrastructure. One thing which is quite clear here is that we will have to give a sufficient boost to our health infra, and more so at district levels, at block levels, something which was announced by the finance minister in the fifth and final tranche of that stimulus package, which was formulated by the central government, wherein it was decided that the government will work upon having a pandemic ready health infrastructure at district level. So we will talk about all these aspects of this particular plan or the program, and we have a distinguished panel of guests with us today. Let me first introduce them to you, beginning with Dr. Vikash, Sheel, the Joint Secretary with the Ministry of Health and Family Affairs, the Government of India. We're also joined by Dr. Rajan Sharma. He's the National President of IMA. And we also have with us Ms. Aditi Tandon, the Special Correspondent from Tribune, somebody who keeps a track on the health sector for quite a long time now. Let me begin with you, Dr. Vikash, Sheel, and let's, for our viewers' sake, let's try and explain to them a little bit what is it that the government plans to do when we say that we have to keep our health infrastructure pandemic ready from here onwards, specifically at the district and block levels. What's the plan and what are the contours of that plan?
Thank you, Vishal. And I'll begin by, first of all, acknowledging that this pandemic has brought many lessons. Our response to the pandemic has been really very proactive and decisive. We took measures, preemptive measures, and our response has also been a graded response. In order to ready our health infrastructure for any possible surge in cases, the Honorable Prime Minister announced the India COVID-19 Emergency Response and Health System Preparedness Package in the first week of April, and it was then approved. And under that, 15,000 crore rupees were approved for the immediate emergency response and strengthening of the existing health systems, that is district hospitals and medical colleges, to ready our hospitals with oxygen beds, with ICU beds, to train our health professionals, to arrange for the safety and personal protection equipment, etc., and medical equipment. But looking ahead, beyond this, so we did a lot of thinking on this, and then prepared a proposal which Honorable Finance Minister was very kind to announce as a part of the Atmanirbhar Bharat tranche 5, wherein it is envisaged that we will prepare the country for pandemic preparedness, not only for taking care of the COVID pandemic, but also for any such future situation if it may so occur. And under that, it is envisaged that all our districts would have capacities to deal with the pandemics on account of three things. First, detection, that is through active surveillance. So it's a very robust surveillance mechanism through integrated public health laboratories at the district levels and in some of the states at the block level. Secondly, the capacity to diagnose in time, develop capacities to be able to do forecasting for any possible outbreaks, etc. And third, to prepare our health infrastructure, our district hospitals, our medical colleges with the capacity to respond, to provide the treatment services and develop that necessary infrastructure. Apart from that, recognizing that a large part of the pandemic response is actually in terms of building the capacities in the communities, awareness in the communities, and taking care closer to the communities. And therefore, under this this Atmanirbhar Bharat package, one of the important components is to strengthen the comprehensive primary health care in urban and rural areas through the health and wellness centers. As you're aware that the government is already committed to developing 1.5 lakh health and wellness centers in the country by December 2022. In order to achieve that, there were certain gaps that have been addressed in this package. But apart from that, in the urban areas, we're going to now change the paradigm of healthcare delivery, because we understand that all the pandemics and epidemics normally start in the urban areas, and there our response systems need a lot of strengthening, and therefore we are going to have a new paradigm for urban primary healthcare delivery through the urban health and wellness centers.
Okay.
Apart from that, certain other institutional capacities are being targeted, such as using IT to deliver health services, services such as telemedicine, teleconsultation, teleradiology, uh, etc. And also to have infectious diseases blocks, hospital blocks in all the districts in the existing hospitals, so that these can be used as a standalone hospitals to provide all critical care services necessary to respond to a pandemic situation.
Okay.
Plus, there is a provision for strengthening of key critical critical care services too.
Okay. Okay. So we'll come to those details also as well. Let's bring in Dr. Rajan Sharma here. Dr. Sharma, your views on the aspects which have been brought about by Dr. Vikash, Sheel, as well as the key takeaways from the last 7-8 weeks, which we have, have been engrossed in this fight against COVID-19. Obviously, there are a lot of lessons to learn for us.
So Vishal, first of all, I would thank Dr. Vikash for his wonderful presentation and his presentation of the views of the government preparedness. But Dr. Vikash will agree with me that still 65 to 70% of the healthcare is catered to and met by my single and couple doctor setups, which are pan-India. The only thing, they are actively partnering the government in various healthcare programs. They are already there. These facilities do not need to be created. They exist.
Mm-hmm.
And in this pandemic, what has taught us is that this is the strength of the healthcare system of the country. We share the burden, major burden of the government agencies and the government healthcare facilities.
Mm-hmm.
We have met the challenge of SARS, MERS, and any calamity which has befallen our nation. We have stood as one. As soon as COVID was there, we assured, got into action, apprised all our branches. We got into a relationship and full cooperation with the Ministry of Health and the Government of India. But as I say, the strength of the Indian medical system has to be created now in a very active partnership mode, where you have to recognize these unsung contributors of healthcare who are there in every small taluka, town, city, who is your neighborhood doctor, giving you affordable healthcare and maybe one of the most affordable healthcare in the world. We are also understanding the fact we are looking at a very severe staff crunch.
Mm-hmm.
We can create ventilators in a matter of months or days, but to create a medical healthcare professional, it takes years. So now, in this crisis, both the government and us at IMA and the other contributors have to become an inclusive group and revisit the health requirements of the country in the coming era and in the future. And we are the ones, we stepped in when the government was not there and was not able, because GDP was very less in health. And we created that infrastructure from our own resources with no support.
Okay.
But today, in the post-COVID era, that single and couple doctor setup will be under the biggest threat, because he will need to change. Gone are the days of 50 to 100 patients in one hospital or OPD. We will have to adopt to smart technology. We will have to give appointments. So these all things are going to be changed. And we have approached, the other day I met Dr. Vikash also. And we have been asking that you should be giving such benefits under MSME to this sector.
Okay, definitely. Those are very important, suggestions there, and I would like to have a response from Dr. Vikash. But before you do that, Dr. Vikash, let's also listen into what Aditi has to say. She's been tracking the sector for quite a long time now. So, Aditi, the way you have seen how our health infrastructure has developed over the past few years or decades, and the need felt in the past few weeks, and the plan which Dr. Vikash Sheel spoke about. How do we look at the entire situation? Suggestions from you, or the way you look at things which need to be done from here onwards?
You see, as far as the health infrastructure of the country is concerned, Vishal, there is no doubt that every government of the day has made its efforts. But for a country as big as India, nothing seems to be enough. So the fact of the matter is that health, let us admit, is the Achilles heel of Indian economy. It is a sort of, a speed breaker in India's growth, and the government of the day needs to realize that investment in health, every rupee invested in health will bring back a return of many-fold rupees. So the thing is that you have to now start seriously looking at improving your investments in health infrastructure. For years, Vishal, we have seen through the national health policies, one after the other, and the latest one that came only 2 years ago, that every government has promised that we will take the expenditure on health, public expenditure on health, to at least 2.5% of the GDP. Now we have not reached there. Efforts are being made, but we need to, speed up our efforts, because you see the pandemic like COVID-19 took the whole world by surprise. So you cannot wait for another tragedy to ramp up your local and domestic infrastructure. It is about time that all stakeholders, like Dr. Sharma said, Mr. Vikash Sheel presented a very holistic view of what the government is thinking. But what I think is there has to be extreme urgency around public health infrastructure. Vishal, if you look at how the best countries in the world are improving their life expectancies and improving the primary health of their citizens, you will realize that countries that put in maximum monies into the development of primary health infrastructure are the countries that derive maximum health outputs and health outcomes. Life expectancies will increase. For instance, you look at Sweden, you look at, countries like the UK, life expectancies are very high. But I'm not talking especially in context of COVID. Of course, the government of India has, through preemptive and proactive approach, done exceedingly well to limit the number of fatalities by way of COVID-19 in India, and also to improve the recovery rate continuously. And through 3 lockdowns, we have also bought ourselves time to create the kind of health infrastructure you need when there is a peak of the disease. So now you see improved, health outcomes even during the period of COVID. For instance, before the lockdown, what was happening is there was only 7.1% recovery rate. But at the end of lockdown 3, the recovery rate has improved to 40%. So you see there is continuous engagement and there is urgency. You're getting results because you have massive investments by way of Prime Minister's announcements, by way of Finance Minister Nirmala Sitharaman's announcements. But my final and bottom line takeaway in this entire matter is that you now have to put in a lot of money in strengthening your infectious diseases surveillance. You did that after SARS. The Integrated Disease Surveillance Program of India, which is the bedrock of our response to the entire COVID pandemic, is fabulous. Vishal, you have 730 districts in the country, and IDSP network currently exists in as many as 712 districts, which means that you already have rapid response teams stationed in every district. Now, like Mr. Vikash Sheel was saying, more money will go into these districts. And the old proposal of the government, if you remember, the 1.5 lakh village level health sub-centers were to be created. So I'm sure the new package that has been announced to keep the country COVID ready will take the village level infrastructure into mind and merge it with the district level, because you have a bottoms up approach.
Okay, definitely. So let me bring in Dr. Vikash Sheel here. Dr. Vikash Sheel, 2-3 aspects which have been brought about by Dr. Sharma and Aditi there. One, obviously, something which has been said quite a number of times, increase investment as far as health infrastructure is concerned. You also started with that, saying that the government is going to do that in a gradual and in a structured manner. Active participation of all the stakeholders, as Dr. Sharma said. Perhaps the PPE mode would be a better way to go about, as suggested by Niti Aayog also in one of its papers.
Yeah, so I'll take these two, issues separately. In terms of the approach, our approach has, from the very beginning, has been a multi-sectoral approach. And that basically means that we are actively collaborating with all stakeholders. So, as you would understand, most of the determinants of health lie with the other ministries, other departments, uh, like, for example, safe drinking water or air pollution and things like that. So therefore, our approach has been a one government approach where we've from the very beginning adopted a strategy to engage with all the stakeholders so that we have a coordinated and a cohesive strategy, and we are able to counter the challenge posed by the COVID-19, and that includes the private sector also. There's no denying the fact that a large proportion of medical care, at least, is provided in the private sector, especially the tertiary care, and therefore we have been partnering with the private sector formally now through the Pradhan Mantri Jan Arogya Yojana, Ayushman Bharat also, and during the COVID period also, we've seen that the private sector has responded to our, to the necessity of participation wherever such necessity has arisen. We believe that uh, through a coordinated approach and making sure that the small nursing homes and the private clinics also are able to function, I think we should be able to deliver a better response. There is no denying that fact.
Okay.
As far as investments is concerned, I think the first announcement of the Honorable Finance Minister was that public expenditure in health will be increased. And then she proceeded to give the details of the interventions which are envisaged for pandemic preparedness. We must remember that as of now, public health is a state subject, and so states are also charged with the responsibility of healthcare delivery. And when we talk of public expenditure on health, it's a joint responsibility of the central and the state governments.
Mm-hmm.
I'm sure the central government has enhanced the resource allocation to health significantly in recent years. The states are also doing the same. And I'm sure that the commitments in the National Health Policy 2017, which envisaged that by the year 2025, we'll raise our public expenditure on health to 2.5% of the GDP, should be realized. And I'm sure that sufficient investments will come in the health sector. I mean, the COVID pandemic at least has brought health into the priorities of governments at all levels.
Basically, back in focus, the health infrastructure. Definitely, Dr. Vikash is right in pointing out that we will have to go ahead and look at the priorities here as far as health sector is concerned. Concluding comments from you, Dr. Sharma, in terms of all the aspects which all three of you have pointed out so far. It looks like it will have to be a very coordinated approach, not only the central government, not only the state governments, but also individuals and other stakeholders, specifically the ones which you mentioned, the single doctor and couple doctor setups. They are the backbone.
Yeah, they are the backbone. See, I would again say, comprehensive approach, IMA bats for one nation, one set of guidelines. As in a war, you don't have multiple rules and regulations. So IMA has been approaching the ministry for one set of guidelines across the country. And personal safety of a doctor or a nursing professional, we already know they are a precious commodity, including me, that their security and personal safety in times of COVID is of prime importance, especially the younger interns and residents. So I would rather appreciate if a special PP bank is created for resident doctor associations where they are made in charge, rather than things coming that such is not there. Halanki, we are now the second largest producer in the world.
Mm-hmm.
And also, I would again, you'll say repeat it, in terms of war, you don't close the army college. So I urge Dr. Vikash to immediately think of opening up the medical schools and nursing schools, because they cannot be equated with the other educational establishments.
Mm-hmm.
This is the time for them to gain experience, vital experience, to be battle ready for the coming times also and for the future also.
Okay.
So these needs to be visited.
Mm-hmm.
Now, Singapore and Hong Kong, I was discussing, when SARS came, they immediately ramped up their critical care, ICU care all across the country. Now they are small. India is a resource challenged country as far as the population size is concerned. Whether it is the testing or vaccination, it is going to be the huge challenge for the health ministry.
Mm-hmm.
And I agree with them. But yes, we need to be taking a practical approach to all this. And we need to build up our setups in stages. And at the moment, I think, which Dr. Vikash must be already doing, that the entire intention of the country attention is on the red spot areas.
Mm-hmm.
And let's see how the things shape up. But
Okay.
yes, I'm glad the private sector is back in the reckoning
Okay.
and started functioning.
Okay, wonderful. Quite some good suggestions from there onwards. I'm pretty sure Dr. Vikash Sheel and his other colleagues in the government would definitely take note of them and work as and how required. Aditi, final words from you on the show on this particular aspect. Way forward from here onwards. All of us know what needs to be done, but way forward from here onwards.
Vishal, the first thing that I want to say is that it is very well taken that without the doctors, the fight against COVID cannot be won and can never be won. And there are a range of COVID warriors in the field today to protect you and me from the virus. But the fact of the matter is that out-of-pocket expenditure of on health in our country is way too huge. It is around 64.2%. All health, out of entire health expenditure, 64% is going out of the pocket of ordinary people. Now the thing is that the government of India had enacted a very important law in 2010, the Clinical Establishments Regulation Act, and had sent it to the states to implement. I believe it is also time, like Dr. Rajan is pointing out, that it is time for collaboration between the government and private sector for pandemic management. Likewise, there is also time is ripe for private sector and public sector to come together to reduce the burden on the common persons. The doctors and the IMA should perhaps take a lead in ensuring that a lot of services, a lot of testing that is done in the private sector, is rationalized. For instance, one procedure in one hospital will cost 10 different prices in 10 different institutions, and Max will charge something else, Fortis will charge something else. Even during the COVID pandemic, you remember the Indian Council of Medical Research had to actually appeal to the doctors to keep the costs of testing low, and the price for the private testing was capped at rupees 4,500. And we remember from the time of swine flu, the private test costing had gone up to 10,000 rupees. So I'm sure with the able leadership of Dr. Rajan in the IMA and Dr. Vikash and the government, the way they're working together, something will also be done on the side of pricing, because ultimately the health consumer should also be kept in mind.
Okay, obviously the health consumer, the common man at large, is the one for whom everybody seems to be working towards that particular goal, be it the IMA or the government. Dr. Vikash, before we bring this to an end, some very interesting and important suggestions from both the panelists here, Dr. Sharma and Aditi. I'm sure the government would be thinking on those lines only.
Yeah, so I'll just take Aditi's suggestion first. So we are all aware that around 65% of expenditure on health in India is out of pocket, and if we dig a bit deeper in that statistics, 70% of that is on account of drugs and diagnostics, and we also know that around 70% or maybe 80% of the total healthcare is outpatient care. So keeping that in mind is that's why when we decided to implement the Ayushman Bharat Health and Wellness Centers, the whole idea was to strengthen the primary care so that for small little things, people don't have to run around and travel long distances to seek care. And both essential drugs and diagnostics are provided at these health and wellness centers. So in rural areas, we have already started around 40,000 such health and wellness centers are already functional. You'd be happy to note that more than 15 crore people have visited these facilities in the last 1.5 years. And now we are under the new reforms agenda also going to reform urban primary healthcare and have urban health and wellness centers also. I hope that that investment in primary care will lead to not only reduction in out of pocket and also increase in public health expenditure in India, particularly on the primary care side, because the national health policy, by the way, also stipulates that while we make 2.5% of the GDP, spend to 2.5% of the GDP on health, 2/3 of that should go to primary care. Fully understanding the importance of primary care interventions in terms of reducing the cost of care. And I fully agree that we need to have a multi-sectoral, multi-stakeholder approach for addressing any epidemic or pandemic. So we will work together with the private sector in terms of finding best ways of serving the citizens in the best possible manner.
Okay, there it is. Thank you so much, Dr. Vikash, Sheel, Dr. Sharma, and Aditi as well. This indeed is a very vast subject and a very engrossing one as well. We can go on, and there are other aspects as well. But the gist of this discussion here, wherein all our panelists are pointing out, is that we have learned some very key lessons as far as our fight against COVID-19 pandemic is concerned. And as Dr. Vikash pointed out, the focus has to be on primary care. Obviously, critical care also needs to be looked upon. All stakeholders will have to work together, and the investments will also have to be increased so that ultimately the common man for whom all these efforts are being made does get the benefit. Thank you so much, all three of you. Thank you for watching Rajya Sabha Television. And don't forget to follow all the guidelines, specifically with respect to social distancing when you step out of your house, because this fight is still on against COVID-19. Thank you.
Thank you.